In a rural area with multiple challenges, both from a provider standpoint and a patient standpoint, that provider and that patient both need to be wrapped in a community that cares and understands that disease and that process, and willing to really accept anyone in need into that community. So a provider in a rural area, they need to be a part of the local coalition, both from the standpoint of influencing the coalition with the knowledge and expertise that that provider has, educating them on HIV transmission, decreasing stigma, those sorts of things. But also to understand what the coalition is able to offer to the provider and to the patient. A provider trying to practice in a rural area by themselves is not going to be as effective as a provider practicing in a rural area that is collaborating with other programs. And those programs, I think, need to be both faith-based and community-based. We know for a fact that community improves someone's health, and we know for a fact that isolation makes someone's health less favorable. It increases their risks. So we know that isolation increases a patient's risk to a whole wealth of poor outcomes. So linking patients to community is an important thing to do, and churches allow that. Also, nonprofit organizations in the community that might be able to increase the provider's ability to leave the four walls of their clinic and get out into the community and to do screenings at community events or even out in the street periodically through community nurses. Being willing to embrace technology so that the provider's clinic in a rural area can have access to specialized care through telemedicine or through programs like Project Echo, linking to other state programs with the health department or Maytech or others is really important to be able to bring both harm reduction and education to communities. Ultimately, the provider having access to a whole community of care, that when a patient needs something, the provider is not alone, and that provider can then wrap that patient in the care that they need and they deserve.